Childhood Cancer Awareness Month. Cancer is the leading cause of disease-related death for children, and over 10,000 kids every year are diagnosed with the disease. But advances in treating pediatric cancer continue, and here with the latest in that fight is Dr. Ricardo Flores of the Texas Children's Cancer Center, the largest cancer center for children in the country. Good to have you here. Welcome to Arizona Horizon.
Thank you. Thanks for the invitation.
Pediatric cancer, it's a lot of kids. That sounds like, how common is this?
Well, basically, we diagnosed about 16,000 kids a year in the United States alone. When you think worldwide, we're talking about 250,000 patients. So that's about one kid every 3 minutes. The family received the devastating news that their kids have a catastrophic disease.
The most common forms of childhood cancer, what do you see most often?
The most common one is leukemia. And after leukemia, we have lymphoma, which is cancer of the lymphatic tissue. After that, we have brain tumors, and also we have tumors of the muscles and bone.
And when you're treating pediatric cancer, compare now to adult onset cancer. How do you, the dynamics have to be different.
The dynamics are definitely different, but I think it's very, very interesting because our patients actually, they take the news much better than adults. I think their life changes and they understand that there's something different. But they become used to everything, to their new lifestyle. Even when their hair falls, the parents are more concerned than what the kids actually are concerned, and they're just like, you see them playing in the clinics. They're happy. They seem happy. They seem energetic. So they're not brought down by the disease actually.
That's an interesting point because you don't think about it. They are kids and they haven't had maybe the experiences that the adults have had, so they don't look back and wistfully and this is life. This is what's facing them.
No, definitely. And for example, I specialize in bone tumors, and it's impressive sometimes. Sadly, we have to do big surgeries, more big surgeries, even amputations or prosthesis. And it's very, very interesting to see how within a few weeks they're just like up and going, like nothing happened.
Okay. The best way to ID early signs of childhood cancer, what do you see out there?
Well, basically what we see more often is that the patients or the kids at home get more tired. They can have frequent bleeding episodes or easy bruising. They have frequent fevers. They have pallor or hip pain, bone pain. But what we usually tell the parents is that you seem to notice that there's something different with the kid. They keep taking them to the pediatrician and they don't get better. They get treated for a flu or some sort of respiratory infection, but they don't get better. So at that point, you have to use your sixth sense as a parent and understand that there's something that needs to be looked at more in detail.
And pediatric cancer in general, we can get to some specifics if you'd like, but how treatable once you get a hold of these kids?
Well, it's very interesting, and what we try to make aware the public during this month is that over the past 4 decades, we've made great progress in cancer treatment in kids, especially because we do a lot of research, and with the help of the public funding and the government funding. So we have improved from probably around 20% survival in kids before the 70s to 85% survival as it is currently.
My goodness.
But what we have to understand is that it's still the #1 killer disease-wise in the nation. So it is still a huge problem. So in order to cure that 15% that we have left, we want to reach the 100% survival in our kids, we need the support from our public.
Yeah, indeed. We hear a lot about immunotherapy these days in cancer research, and you hear a lot about it with adult onset cancer, but is immunotherapy a treatment option for kids?
Yeah, definitely. So this is one of the newest research modalities or treatment modalities that we're investigating right now. And that's why we're talking about the support and the funding, because we need to get this type of treatment modalities further along, because the type of treatment that we use is called conventional therapy, and that includes chemotherapy, radiation therapy, and surgery. So over the past 20 years, we have been able to, I will say, optimize the treatment using those tools, but we need newer tools. We need newer treatment, and one of those is, for example, immunotherapy. We have also precision medicine, in which we try to treat the specifics of the disease of your children, of your kid, rather than chemotherapy that is more generalized.
Interesting, and I was going to bring up that fact. I mean, genetics, risk factors, what's out there as far as pediatric cancer?
For pediatric cancer, we're doing lots of progress in that aspect too, which is trying to, with a simple, for example, simple blood test, try to analyze in a comprehensive manner the genes, the proteins in the blood of the kid, and then come up with an individualized picture of what type of therapy or what type of drug will actually work for you.
You know, you've talked about the advances in treatment, advances in research, but when it comes to a parent hearing that news, it's got to be devastating. It's always, I would imagine, devastating. Are you seeing, though, improvement in the outlook or more optimism from parents, or let's put it this way, less negativity and more hope from these parents once they get this diagnosis?
Definitely. At the beginning, of course, is very devastating, but with the social support, with the family support, and with the support of the Cancer Center, they get over that initial shock and then realize, okay, this is something that we have to deal with, and we're going to do whatever is in our hands. And then when they see other kids surviving, 85% of the kids surviving, and many of our medical staff, nurses, and volunteers are survivors of cancer. So,
wow.
So in that case, they understand that this is something that is treatable, and you have to do your best.
Well, continue the good fight. Congratulations on your success, and we hope for continued success on that front. Thank you so much for being here. We appreciate it. And Tuesday on Arizona Horizon, it's time for our monthly review of the latest science news with ASU physicist Lawrence Krauss, and we'll hear from the new Poet Laureate of the Navajo Nation. That's at 5:30 and 10 on the next Arizona Horizon. That is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.
Arizona Horizon is made possible by contributions from the Friends of Eight, members of your Arizona PBS station. Thank you.